Hello, my name is Monica Villegas, and I will be discussing hemorrhagic cerebral vascular accident. Hemorrhagic stroke is defined by Yale Medicine as a neurological emergency that occurs when a blood vessel inside the brain, intracerebral, or on the surface of the brain, subarachnoid, ruptures. According to the American Heart Association, 800,000 people a year suffer a stroke, and more than 2/3 of stroke survivors require rehabilitation after hospitalization. The most common cause of stroke is high blood pressure, hypertension, followed by cerebral aneurysm, and arteriovenous malformation. Cerebral aneurysm occurs when increased pressure of blood passes by a weak spot in the wall of an artery, eventually bursting. Arteriovenous malformation is an abnormal formation of a bundle of arteries and veins. Common signs and symptoms of stroke include sudden severe headache, double vision, confusion, lethargy, memory problems, trouble speaking or understanding, weakness in the face, arm, leg, or side of the body, loss of sensation on one side of the body, nausea and or vomiting, loss of consciousness, seizures, and stiff neck. However, symptoms may vary depending on location of injury. Stroke generally presents as sudden intense headache, vomiting, stiff neck, and high blood pressure. Hemorrhagic stroke presentation is usually acute and progressively worsens. Risk of stroke is twice as high for non-Hispanic Black adults as for white adults, and non-Hispanic Black adults and Pacific Islander adults have highest rate of death. People aged 55 years and more are at a higher risk, and men are at a higher risk versus women. Common OT assessments for stroke include visual assessments such as Occupational Therapy Adults Perceptual Screening Test, Rivermead Perceptual Assessment Battery, and the Behavioral Inattention Test. The Behavioral Inattention Test assesses for unilateral visual neglect. For memory and cognition, there is the Mini Mental State Exam, Cognitive Assessment of Minnesota, Assessment of Motor and Process Skills. The Mini Mental State Exam is 11 questions used to check for cognitive impairment. For sensory motor and upper limb function, there's the Manual Muscle Test, Grip and Pinch Strengths, 9-hole peg test, and the Modified Ashworth Scale. The Modified Ashworth Scale measures spasticity in stroke patients. For activities of daily living, there's the Functional Independence Measure, the Modified Barthel Index, and Assessment of Living Skills and Resources. The Modified Barthel Index assesses activities of daily living with higher scores indicating greater independence. Some general precautions when working with patients who have suffered a stroke include that they may be at a higher risk for falls, they may be at a higher risk for seizures, their risk of having a secondary stroke is higher, with 1 in 4 people suffering a secondary stroke, behavioral and cognitive changes, and sensory impairments. Some occupational performance deficits someone with a stroke is likely to demonstrate include difficulty dressing due to apraxia. The client may understand the command to put pants on, but cannot perform the task due to motor apraxia. They may have difficulty eating due to dysphagia, which is difficulty swallowing, various textures, and may require a specific diet. They may also have issues toileting because they may become incontinent either because their brain cannot tell when they need to use the restroom, or they have communication issues that doesn't allow them to let someone know they need help. Thank you so much.